Welcome to our Mary Greeley Primetime Alive on Fall Risk Reduction Continuum. I'm Vicki Newell with the Mary Greeley Primetime Alive program. As a reminder to sign up for programs, get more information about Primetime Alive, or to join, you can go to mgmc.org/PTA. Our presenters today are Matt Petersen and Lisa Haggas. I'm going to introduce both, and Matt will be the first speaker. Matt has been with Mary Greeley since 1993. He is a Wartburg College graduate and then went to Des Moines University for a master's in physical therapy. He started at Mary Greeley as a staff therapist and worked his way through management and has been the director of the program since 2019. He has added a master's in public administration from Drake University along the way. He has been part of the Walk with Ease ISU research team for the last 2 years. Lisa has been with Mary Greeley Medical Center since 2004. She is originally from eastern Nebraska. She received her undergraduate degree in Human Health Sciences and Master's of Physical Therapy from Clark College in Dubuque, Iowa. Lisa has been certified by the University of Pittsburgh as an advanced vestibular physical therapist, and she is LSVT Big certified. Her areas of professional interest include balance and vestibular therapy, neurological conditions, and Parkinson's disease. Please welcome first Matt Petersen.
Thank you, Vicki. And I have no doubt you will correct me or interrupt me to keep me on the right track when needed. All right, thanks for coming. I'm going to share a lot of information with you today. I saved the real hard and technical stuff for Lisa, so I got the easy stuff. So our main objectives today, we'll spend a lot of time on them, but we want you to understand the factors that increase your fall risk, identify the fall risk that you can change, let you know about some community-based activities to reduce those fall risks, help you understand when it's important for you to talk to your healthcare provider to consider additional intervention, and then this is where Lisa jumps in, is learn about the high-tech physical therapy interventions available at Mary Greeley Rehab and Wellness. So, all right. Feel free to stick your hand up whenever you want. That's not a problem for me. All right, so very briefly, let's look at the problem of falls. And this data is several years old, but more than 1 out of 4 people 65 and older fall each year. That's a high number. 3 million are treated in the emergency department for fall injuries. Now, I was able to get some information about Mary Greeley. Just guess how many emergency department visits there are a year. I won't. At Mary Greeley. Over 33,000 emergency department visits every year, right here in our community. About 1,800 of those each year are fall related. So that's only about 5.6, or is it, I don't know if that's only or if that's a lot, a high number, but are fall related. 5.6% of those 33,000 plus visits are fall related. And also, they have to call trauma alerts, which is like, let's get the whole team in there. They did 433 of those last year, and the majority of those were fall related because people coming into the emergency room or fall and maybe hit their head. If they're on any anticoagulation medicine, blood thinners, they're really worried about that a little bit more. So that makes it much more serious. So that might relate to some of you about your concern about falls, as if you're on those types of medications as well as others. And many of the falls are mechanical falls, meaning you trip over something, or a dog pulls you, or something a little bit unpredictable. However, we can blame that, but I also feel like for older folks as we go through life, the weaker you get, the more your balance generally decreases. You're going to have a lot less room for error. You know, you might, when you used to stumble or trip and recover, you're no longer able to recover and keep upright. So just something to think about. It's very easy to blame something, you know, a rug or whatever you tripped over, but it's part of that is your room for error and your capability. So I'm just always hesitant to blame those mechanical falls on whatever seemed to trip you. So something for y'all to think about, consequences of those falls. Hip fractures are very common, loss of mobility and loss of independence. We know bad things happen sometimes when you fall, and it can really you know, put a process in place that can really affect your lifestyle and lead to loss of independence. You know, hip fractures, you're immobile for a while, and you're going to lose that mobility and your ability to take care of yourself and live independent. So we want to do all we can to keep you upright. Head injuries, arm injuries from the landing, depression and death can even happen. Depression related to the loss of independence and the things you like to do and that kind of thing. And then obviously death if it's a severe fall. So, all right, so we looked at falls, the problem, and why we want to stay upright. Let's look at falls, the solution. The CDC has a program called, it's STEADY. It stands for Stopping Elderly Accidents, Death, and Injury. And they have fall recommendations for that. And they're very good. They're evidence-based and proven to work. Their 3 steps are screen for fall risks, assess the modifiable risk factors that you have and try to make the changes that you can, and then intervene with effective strategies to reduce your risk and get yourself stronger. The great news for you all is all of these are available right here in Ames and the surrounding communities. And we're going to talk a lot more about those options coming up. I also want to put another layer, and this slide, I kind of modified this slide since this was printed. So this is a new slide, information's in there. But the Story County Fall Coalition has been in existence for maybe a year-ish. So it's a coordinated county-wide effort to reduce falls in the community. Iowa State, Mary Greeley, McFarland, Story County Public Health, our ED is involved in this as well. You know, just looking for ways to reduce fall risk, trying to integrate within medical records. We're working on that process to make the appropriate fall risk referrals and things like that. It's part of the Iowa statewide fall coalition, but really Story County is the leader of getting it down to the county level. So Iowa Fall Coalition is trying to use Story County as a model to build the coalition statewide. So it's really kind of exciting that our community is doing that. And there's also the Iowa Community Hub, which is I had to write notes down on that. Their mission is for connecting communities with health promotion programs and facilitating the referrals. So things like any health-related social needs, chronic disease, and wellness type programs, providers can refer, or you could self-refer to the Iowa Community Hub. And then statewide, they're trying to learn and make those referrals statewide to whether it's people like us in physical therapy or, you know, like cancer support, diabetic management, all of those wellness type needs. So it's really kind of still in development, but we think it's the direction that we're going to build these statewide networks in the community hubs. So Anyway, that's just a little bit of a tangent that I took you on just to let you know what's going on in the community. Let's get back on track. Is that okay, Vicki?
Let's do it.
All right. All right. So let's look at the screening options. The first one. Well, one of the things we've been doing a lot of, and I think most of you probably heard about community fall screens. Have you been to any of our fall screens? We did some at the hospital. We've done a couple here. Abby's done some at Iowa State with the Walk With Ease program. You're going to hear from Abby here in a little bit. But this new news, have you seen? How many people have considered or have gone to a fall screen? We got more work to do, Abby. All right, so they're community-based fall screens. We're doing a lot here. In fact, next Wednesday, we're doing one where you come in, sign up for a 10 or 15-minute slot, and we take you through testing and talk to you about the appropriate interventions from that. Are there any openings next Wednesday, Abby?
There are.
There are openings, so. So Abby will be chatting with you a little bit on how to sign up with that, but she'll be up here in just a minute. So she's done screens. We've worked together in Story City. We do them through the city of Ames, Iowa State. We've done various facilities like Northcrest, and just trying to go out and do fall screens and help people identify what their risks are. The other thing you can do is talk to your primary care provider. If you want to screen for fall, they have some tools. Physical therapists will have lots of tools too, but I really encourage you to come to one of those community-based fall screens that you'll hear about. So, all right. So the next step in prevention is assessment of risks. Okay, there are some modifiable risks and non-modifiable risks. Although I pulled this non-modifiable risk factor list, but I think some of those are modifiable. So you can't adjust your age or your gender. But polypharmacy is how many are there 4 or more medications? And you might be able to work with that. If you've got an extensive medication list and are feeling like, you might be at fall risk, directly ask your primary care provider if there's any, or your pharmacist, as far as what could be done to adjust your medications. Vision, and obviously we can correct vision, but we know that poor vision, if it's uncorrected, can lead to a lot of problems or increase your fall risk as well. Poor lower extremity sensation, things like neuropathy, tough to do a lot about. Many other chronic diseases and memory deficits are, we know, many times non-modifiable and increase your risk. So let's look at the modifiable risk factors. I'm going to start over on the list on the right side, because those are external factors that we know are within the home that we might be able to make improvements on. Things like stairs, uneven or wet surfaces. So your living conditions, are your walking paths clear? Do you have trip hazards? Is that dog always running or cat always running around your legs? There's things that, as you get weaker and more at risk, they can cause problems of higher consequences. Trip hazards, throw rugs, grab bars in the right place, in and out of tubs or showers, low chairs and toilet seats and sofas that swallow you up. Those can cause difficulty where you might not get all the way out of them and then find yourself on the floor. Poor lighting, storage that's less than ideal, where you've got to bend down a lot or reach overhead. And then narrow pathways. So those are some modifiable things within your home. Now, I think it's very easy to look at that and say, well, that's never been a problem before. but at some point, those things can become a bigger problem for you. And so I'd encourage you to, if you can't help and make those changes, maybe ask any resources around you, friends or family, those kind of things, to make those changes. Because those are the easy changes to make compared to the next one I'm going to talk to you about. The internal factors, things like lower extremity weakness and poor balance, things like that require exercise. Those are harder changes to make, right? And you know, physical inactivity will increase those the weakness and balance issues. Do you need a walker assistive device, and or are you using the one you have properly? You might need some training on that. Medication issues and errors. Are you taking your medications properly? Low blood pressure can be a problem, especially with position change. If you're someone who goes sit to stand and say, "Whoa, I need a minute," most of the time you can manage that, but I think you need to have that conversation with a primary care provider and see what can be done about that, because one of these times you might not manage that well and could have a fall. Poor vision. And I highlighted the fear of falling. We're going to touch on that on the next slide. And then social isolation and depression, because if you become more inactive and do less, then all of your tendency to have all those risk factors get worse from the inactivity and isolation. All right, so the fear of falling is, you'll see it over there on the right. The STEADY program, they use a questionnaire that helps us identify fall risks. And I won't go into that in detail, but that's part of the community fall screen. The fear of falling, they've highlighted a couple questions, and we know that if someone says, "Yes, I have a fear of falling," that correlates to actual falls. It's one of the best questions and correlations that we have. So if in the back of your mind you're a little afraid of falling and know that's a concern, you know, that's something that you should address sooner than later and see what you can do. And we're here to tell you about what you can do. So if you have a fear of falling, what do we tend to do? Well, we're afraid to move and go out and do things. It decreases your activity. When you decrease your activity, you get weaker, which sets you up for a fall again, for more fall. If you do have a fall or a near miss, you tend to do less, and it's just a bad cycle that perpetuates over time. So if you're having these concerns or fear of falling, or there's some other signals that we'll talk about coming up, really encourage you to try to do something about those sooner than later. Right, Vicki?
Yes.
Okay. All right. All right, so let's talk about interventions, and I'm going to talk about the community-based interventions a little bit, but I'm actually going to start out. I'm going to invite Abby up to tell us about the program. Do you have the microphone, Vicki?
I got it.
Great.
Hi, everyone. My name is Abby Caniglio. I'm just going to have a couple minutes of your time to talk about the Walk with Ease program up there. So Walk with Ease is an ISU research project. It's great to see actually some of my previous participants in the crowd here today. So definitely, can you raise your hand if you participated in Walk with Ease? So if you have extra questions, maybe you can go to one of those individuals. But it's a 6-week walking program. It meets on Mondays, Wednesdays, and Fridays. Our next class will begin on June 2nd, and will be at the Ames City Hall at 8 a.m. It is a program that really helps people get moving again if they've been inactive. We also work with Mary Greeley Physical Therapy to incorporate some balance exercises into the program as well. And yeah, if you are interested in getting signed up, we have a sign up little yellow notepad back there that you can put your name and email and phone number on. In addition, if you're interested in getting screened for falls, you can put your name down and I'll give you a ring here. So if you're interested, please reach out to me.
All right. Thank you. I think Abby's got to leave before she was originally going to plan on sticking around and answer questions or anything, but I think she's got to run here in a little bit. So I'll turn over that list of names and sign up to her afterwards. And then she'll give you a call. So, all right. So that's one big community-based intervention. And we should say that the Walk with Ease program is evidence-based to help people with arthritis, correct, Abby? Yeah. And they are doing research to see if it is successful in reducing fall risk. So that's kind of also what you would be signing up for. So that is the classes. There are several classes that have a evidence-based side to them. I'm not going to focus or worry about that because I really feel like if you are, most people who are here in community active, the important thing is to keep them moving, keep you all moving and engaged and as active as you can. Evidence-based classes are definitely good and part of the therapy that you're going to learn about. But for now, I don't think we have that level of evidence and study till things like the Walk with Ease research catches up to it. But so I'll focus on when I say community-based activity, it is just staying active and taking advantage of those things available to everybody in the community. Classes, like there's many classes, opportunities up here. How many of you have seen the fitness center right across the room? There's a beautiful little fitness center. There is some cost to that through the city of Ames runs it, but it's a great little strengthening, easy to use machines, light resistance. Am I accurate? Yeah. Anybody using it? Or have you just seen it? So it doesn't do any good. It's kind of like the treadmill at home that holds your laundry, dries your laundry. So, okay. So, but really nice strengthening facility. They are also doing classes up here. The city of Ames is doing a lot of them. Mary Greeley does one class up here, but it's more for cancer survivors. But there's lots of fitness classes aimed at the older adult, and they can be tempered. You can self-pace during many of those. There's Silver Sneakers, which is supported by Medicaid and some insurances. I know City of Ames does that. I know we do a Silver Sneakers class in Story City that is very successful. But I like classes because, well, once you get someone into it, they're committed and there's a social environment to it. And I think it improves participation. But if you're active enough and can just stay active, Ames is in a great spot. We've got great Parks and Rec program up at the city. There's many fitness centers, but lots of trails for walking and biking if you're able to do that, mall walking. There's just any type of activity that you can do regularly. is what we want. And that brings me to my suggestions, okay? So if you say, well, I go for walks, and that walk is once a week, and it consists of strolling and not moving to, just kind of taking your time, window shopping, whatever have you, probably not a high enough level of intensity to be significantly beneficial to you. Is that evidence-based? No, I don't have the science for that, but I think I'll win that argument. But so I think you need to consider about what you consider that activity. If your intent is to be moving and improve your physical condition, reduce your health risk, reduce your fall risk, you need to figure out how to do that at a safe level for each of the individuals. If you're using assistive devices, obviously, maybe not going for a long walk on a trail is the best thing to do, or hopping on a bike, or you have to really identify what's appropriate for you. And it's going to need to be sustainable, meaning it's accessible, easy to get to, it's enjoyable, maybe even social for many of you. That makes it more sustainable because you're kind of committed to your friends who you said you've done it. I've done that before. I've committed to, not lately, but the 5 a.m. Fitness class. It's like, okay, well, me and my neighbor are going to ride together to it. So he's picking me up, or I got to pick him up. So guess I better get my butt out of bed and go do that. So, that social environment or aspect really makes it more sustainable. And here's, is it measurable so that you're not just doing the same thing over and over and over? Your body accommodates to that and you get less benefit to it. So you want it to be measurable and progressive. Okay, for some of you, that's a lap around Ada Hayden Park. And how much time did it take you? What's my heart rate? All of the, the electronic devices we have. That's great. And if you're out there, so measure that and maybe even jot that down and see how you do. For others of you, it might be a lap down to the corner and back, or even a lap around your living room, or it might be, I'm going to be on my feet and be active for 10 minutes and watch your heart rate. And can you build your endurance more than 10 minutes or just being around? So you can really, you need to find a level that's most appropriate and safe for you individually, but I encourage you to track that. And also consider the community-based organized activities as well. All right, but people were really here to try to help. Now, if you're really worried, if you're having that fear of falling, if you're someone who's having a hard time going up the stairs or getting off of the toilet or a low seat without using your arms, or if you notice those things are all getting just a little harder than they used to be, that tells me your leg strength, is decreasing and can catch up to you. So strengthening, we can help you with that. Okay, we've got some simple exercises that we can do. Or are you feeling unsteady and when walking, or are you starting to lose your balance a little bit? Near misses, if you're having near misses, those can become more common more often as well. Are you avoiding certain activities that you used to do? So if those are things you like to do, therapy can help you with that. We'd encourage you to find the right activity. Feel free to try that, whether if it's a fitness class, if it's walking on your own, doing whatever. But if you need help with that, I think that's a great time to ask your primary care provider about physical therapy. and so that we can evaluate you and talk and meet your specific needs. We've got lots of exercises and high-tech solution, and this is where I get to invite someone up super smart. So this is Lisa.
I think I'm on. Can you hear me?
Yes.
Okay. Hi, I'm Lisa. I'm one of the physical therapists at Mary Greeley Rehab and Wellness. And what I'd like to do today is take you through just a general overview of what a physical therapy evaluation might look like, and then get into the fun part, which is looking at some of our high-tech solutions for working with balance. For those of you who have not had the exhilarating experience of coming and having a physical therapy evaluation, I do want to give you a little overview of what that looks like, especially as it pertains to balance, because we evaluate many things in the physical therapy world. But general overview, if we were looking at somebody to evaluate their balance, is we want to get a history of the current problem. What's been going on? So how long have you been having this problem? We'll ask you a whole bunch of questions, so that we have a better understanding of what's happening. How many times have you fallen? We also want to look at your medical history too, because as Matt pointed out, there's pieces of your medical history that might be one of the fall risks, and we need to be aware of that. We want to look at your activity level, and this is where I get a lot of groaning, because it's like, oh, I watch TV. Okay, well, we're not going to make your balance better if I let you continue to sit and watch TV. So I need to know your work level, what kind of work you do, what are your hobbies, recreation, how much do you exercise? Because any good balance program is going to include exercise. Cardiovascular fitness is very important for balance, and part of a good balance program is going to include some walking at least. So we need to know what your current level is so that we can start increasing that, but doing that thoughtfully. Start you where you're at and try to gradually increase. We will do a physical examination. We're looking at things like posture, pain, sensation, range of motion, tone, coordination, vision and hearing screening. That is one that I like to be sure I touch on that one every time somebody comes in for balance, because I want to make sure you have the most updated lens prescription. A lot of times with the glasses and the vision, I don't have as many problems with that. I do get a little concerned when I'm talking to somebody and they're like, oh, I wear glasses. Really? You're here. You don't. Are they just for reading? No. I'm supposed to wear them. Well, where are they? How did you get in here? Why are you having your balance evaluated without your glasses? Please wear your glasses. But hearing screening, just a quick, I like to do the finger rub screen where a couple inches from the ears. Can you hear this? Can you not? Oh, you can? Huh, guess what? You need to have your hearing looked at. Or I have people that'll say, I have hearing aids, but I don't think I need them. I don't wear them. Falls and hearing, there is a link. While they don't fully understand the link between hearing and fall risk, there is a link between them. So if you have hearing aids, you should be wearing them, especially if you've been having falls. We look at mobility. How do you walk? How do you lay down? How do you sit up? How do you stand? How do you do the stairs? So all of those, basic tasks to move you around your home, we want to look at that. Okay, and then we get into the really fun part, which is the balance. There are many different types of balance, and we need to look at that. Based on what you told us in that history of the current problem back in the beginning, that's going to start giving us ideas about, okay, I think this might be where you're having problems at. So we're going to look at things like your static balance. Okay, that's just being able to stay in one place and stay in that posture. Or dynamic, that's weight shifting, that's reaching, that's doing things where you have to constantly be moving your center of gravity over your base of support, and we're moving. Reactive balance, that's your tripping, slipping. Can you recover that when that happens? Anticipatory, that's doing the things that you do all the time, you know it's coming, like standing up. Okay, you've done it many times, you've learned it, can you still do that? And then dual tasking is a big one. So are you walking along and it's all just gotta keep my balance, gotta keep my balance, gotta keep my balance? Or can you walk and talk and have a conversation and think about your grocery list and have a conversation and do those things? Dual tasking is important because rarely do we just walk along in the world ignoring the world around us. We have to be able to interact at the same time. We take all of that information, we make an assessment. That means we interpret the findings. We might go through with you and say, okay, here's all that balance testing we did. Here's what it means, and here's what I think it means in your situation. And then we need to set some goals. What do you want to get out of coming to therapy and working on your balance? Because if it's not salient to you, what are we doing? We got to make sure that we're not just, I'm not making up your goals. What do you want to get out of it? So I want to make sure that we're doing what you want to get out of it. We also set up the plan. How often are we going to see you, and for how long do we think we're going to need to see you? And then I like to hit on home program expectations. Yes, you're going to come to therapy, and yes, you're going to work with a qualified therapist who's going to put you through the rigorous activities in the therapy session. But what really gets you better is what you follow through with at home. We'll be giving you a program to work on, and what we need to see is that you follow through with that program so that when you come into therapy, we're really just advancing that program and doing the things that you would need to do with another person there to be safe. So I like to set that expectation from the beginning because that's really what's going to help you get better. So how does a PT specifically evaluate balance? We look at all those individualized needs, we take all of that information, and we start working on looking at what balance systems are working and which balance systems are not. Okay, we'll talk about those balance systems on the next slide. You have 3 of them. We'll go through them. And then back to that type of balance. Is it a static or dynamic balance problem? Is this reactive? Is this anticipatory? Is this walking? Are you having trouble with dual tasking? And do you have some strategies you're using that are working? And then are there some strategies that aren't working so well and we need to look at that? And I just found this picture on the internet. I thought it was really, really cool, and I kept looking at it for photoshopping, and I was like, I don't think that's photoshopped, but I thought it was pretty fun. So going back to the 3 systems that contribute to balance. You have 3 systems that help you with your balance. 1, your vision, your eyes, what you're seeing, okay? So again, wearing that eyewear that you should always have on. And your vestibular system, this is your inner ear. So if you look at the bottom picture, we're talking about your inner ear. Now I said hearing was related to fall risk, but your vestibular system is not your hearing system. Your inner ear is a system that is your balance organ in there, okay? We've got a center chamber, we've got 3 canals that come off of that. You've got 1 on each side, okay? So you've got 2 of those, okay? And then your somatosensory system. That's a combination of proprioception, muscles, joints, skin. That's feeling where you are without having to look. Okay, so that's what allows me to know where my right foot is right now. Even though I don't need to look at my right foot, I can just feel where my right foot is. Okay, and then all of that information from all 3 of those systems gets processed in the brain. What types of tests do we use as a PT to test your balance? Well, there's many different ways we can do it. We have self-reporting measures, which are, maybe we'll give you a list of questions and we'll talk about how confident are you in your balance in certain tasks, and you'll write a percentage and then we take an average of all those percentages. So that's one way we could do it. There's objective balance tests. A lot of them are where we have you perform a series of tasks that challenge your balance to varying degrees, and then you get a score for each one of those tasks. And all of these that we use have been well researched, where they have identified a normative range. So we're comparing the person we're examining and evaluating, we're comparing them to maybe people of their same age group. Sometimes it's age and gender. We even have some, if you have a certain medical diagnosis, we might be able to compare you to that group of people. So for example, here's what's normal for somebody without Parkinson's disease. Here's what's normal for somebody with Parkinson's disease. Not every test has all of those different norms, but there is some sort of norm with it that we would be comparing to start identifying fall risk. The three-legged stool picture is what I like to show. I think it's a great analogy to use because you have three balance systems, okay? And if one of those legs of the stool, one of those balance systems isn't working, your stool is going to fall over. One of your balance systems isn't working, you're going to fall over, okay? So that's what the three-legged stool is there for. Okay, so low-tech balance testing. I would like to be clear that I love high-tech balance testing, but our low-tech balance testing is very effective, okay? So don't, as much as I love working with our virtual reality and all the things we're going to show you, there's good low-tech balance testing. I'd just like to be clear on that. So again, that's those paper and pencil tests where it's all the different activities and then we score based on how you perform those different activities. The example I use today, we call it the modified CAT-SIB. This is one that is used to start sorting out which balance systems are working and which ones are not, okay? So if you came in, just like the woman in the picture, one of our favorite pieces of equipment that you'll either learn to love or hate, okay? We'll have this with us. Now in the first picture, she's standing on a firm surface, feet together, eyes open, all right? All three of your systems are working, your eyes, your inner ear, and you've got that nice firm floor under your feet. So all three systems working, this is kind of your baseline. Can you stand here for 30 seconds? Okay, great. Let's take away a system and make you use two systems, okay? So can you stay with your eyes closed? So we took vision out, so you've got to use your inner ear and your proprioception a little bit more. We test you there. Okay, then we bring in the fun stuff. Now we're going to impair that somatosensory, that somatosensory system because we're going to put you on something that is not solid anymore. So it cheats you towards having to use your inner ear and your eyes a little bit more, okay? All right, so we do that, and then let's make sure I don't fall over and test myself here. And then we do eyes closed, okay? So now you mostly have to use your inner ear. It's weighted more towards the inner ear because you're not using vision, and you don't have the firm feedback from the floor anymore, okay? And looking at how you respond in those different conditions helps us start to identify which systems are working, which systems are not. So let's get into high-tech balance testing, okay? Virtual reality, the wave of the future. And so who is familiar with virtual reality? Okay, all right, so we got a couple of people. So this is a digital technology that creates an artificial three-dimensional environment. Whoever's using it can interact and manipulate objects in real time. There are different types of virtual reality. There's non-immersive, which is the top picture that you see up there. So the woman in the white shirt standing on her Wii Fit board, and she's got the TV, okay? So that's sort of like a video gaming thing where she can still see the world around her, but everything that's being controlled on the screen, she is controlling either with her body or with controllers, okay? So that's non-immersive. Semi-immersive would be the second picture. So this is like some sort of driving simulator or driving game where you can still, if you looked around, you could see your environment, but your immediate visual field is pretty much going to be what you're interacting with, and that's going to be responding to you in real time. And then the bottom picture shows the immersive virtual reality. Okay, so you can see he has the visor on, there's sound coming through that, he's got controllers. He can't see the rest of the world when he's in this, okay? Your world is the virtual world that you see inside the visor, okay? Sorry about that. Okay. So some of the benefits of virtual reality. There is a lot of research, and the research just keeps on coming because as soon as they get the research done, a new piece of technology comes out. So it's been really hard to keep up with the various technologies. And you just saw there's 3 different types of virtual reality. There's so many different diagnoses out there for people. But what they are finding is that despite all of that, they have shown benefits using VR. They found benefits in improving balance, leg and arm function, motor control, functional ability, cognitive ability, proprioception, pain control, and joint mobility. Now, is VR better than doing conventional therapy? They've done studies. People have done conventional therapy without VR. They've done only VR. And what the take-home message at this point in the research is that virtual reality therapy enhances conventional therapy. Okay? So you can still get good treatment with conventional therapy, but the VR can enhance treatment. And some of the reasons for that is it induces repetition. Okay, so you want to beat the game. You're competitive. You just can't help yourself. You want to do it over and over and over again. And raising up that controller and shooting that bow and arrow was a lot more fun than picking up the 1 pound weight over and over and over and over again. It was just more fun, so you just feel like you want to do it more. It enhances motivation. Maybe you're competing with yourself. Maybe you've got somebody else that's going to therapy too, and it's like, oh, I did that game, and this is what I got. Okay? And it enhances the enjoyment. Bottom line is it's fun, and it doesn't feel so much like therapy. Here we go. So this is an example. One of the reasons I picked out that modified CAT-SIB test is because I have footage of an actual person who agreed that it was okay for us to film him doing a similar test in our virtual reality unit called the Virtualis. So this is just a short clip of that. So you can see he has the visor on, so he can't see the world around him. It's got the headset on, it's talking to him. I do have the gait belt around him just in case. I'm still always right there, and right now he is on that firm platform. I'm getting him into the test. So we'll just play through here. There we go. Get the headset on. I'm all set up. Now the platform raises up because when we get into some of the modes where we want that movable surface, it's got to be up a little bit higher. Right in through here, you can see the platform's now a little bit more responsive. It's moving with him, so that's more like when it's on the foam, okay? So it starts out solid surface, okay, and then he can see a fake room in the visor, and then room goes black, can't see anything, and he's still on the firm surface, so that's like closing the eyes. And then this one actually has a little bit of a trick in there where the surround is moving with him. And then it's the platform unlocks and it moves with him. So that's like the standing on the foam, and we do eyes open, eyes closed, room moving with. Okay. Anybody want to see that again? Or you kind of got it? Kind of got it. Okay. Maybe we'll move on. Okay. So we want to look at two when we're looking at a balance problem is what if dizziness is contributing to a balance problem? Well, we need to evaluate that. There can be many, many different causes of dizziness and vertigo. And I've listed some of those things out there. This is by no means an all-inclusive list. These are just some of the things that can cause that. One of my pet peeves, and we have another therapist here that just joined our team, Gretchen, and I'm sure she's had this experience too, where people come in and they say, my doctor diagnosed me with vertigo. Okay, well, I would call vertigo a symptom. We need to figure out what your vertigo is coming from. Vertigo is a symptom, not a diagnosis. And physical therapists that work in vestibular therapy can really help to start sorting out what is the source of that vertigo, because a lot of things are treatable, and we want to help that get better. Okay. Of this list of problems, one of the things that at the very bottom, again, Matt touched on medications. Medications, many have a side effect of dizziness. And we need to start looking at, is that causing an issue for you or not? Do we need to talk to the doctor about that? But that's one thing we want to make sure we include in that assessment. Low-tech testing, when we're evaluating dizziness. It includes a good oculomotor exam, taking vitals. Again, we have paper and pencil tests where that might be asking you a lot of questions, that might be having you do things, testing you in different positions to see are your symptoms dependent on the position or the movement you're doing, okay? Again, you can do these things in a low-tech environment with the right therapist would do a good job. But it's also really nice to have that higher tech in our back pocket because it makes it a lot easier. We can see more, we can do replays with our video Frenzel lenses. Now, this is not us, our clinic, but this is from the company, and it gives a really good depiction of what this system does. So when we are evaluating dizziness and vertigo, one of the things we're really looking at is we're really looking at eye movements. There are a lot of eye movements during certain tests and positions that you can't control, and we're looking for normal versus abnormal eye movement, okay? By putting you in this system where we can see your eyes, even in the dark, you do have to have your eyes open. I tell people it is not x-ray vision. We cannot see through your eyelids. You still have to have your eyes open. And we can see your eyes very closely, and we can be recording. So give me just a minute to run this at the point that I would like to pick it up at, because this looks very similar to what we be doing in the clinic. There we go. Okay. So we have the person in the goggles, we take them into one of our test positions, and then we're looking at our monitor where we can be looking at what the eye movement is while we're in this position. The reason it's advantageous to do this in the dark without you having something to visually fixate on is a lot of the abnormal eye movements can be suppressed, especially people who have had dizziness or vertigo for a long time. They've learned to live with it. And so if you give them a focal point to focus on, they can suppress a lot of that abnormal eye movement. And we need to see that so we can start getting a sense of what is going on. Okay. That's a bit of what that looks like. And we have those available at Mary Greeley. Okay. So now let's say, how does a PT treat a balance problem? Okay, we create an individualized balance program for you. We want to target training up the systems and strategies that are impaired. So do you have a system you're not using well? Well, then let's start doing some activities to train that system up. Is there a strategy that you're not using that you should be using? Hey, are you using your cane? Okay, well, come on now, let's use that strategy. We also want to use our functioning systems and strategies to improve safety. So until we can make an impact, until we can get another system that's not working better, can we help you to use these other systems that are working to keep you safe in the meantime? Treatment includes a one-to-one session with a PT, or we have physical therapy assistants that you might work with. And again, there's that big one, home exercise program. Repetition, repetition, repetition is what's so key to so much of what we do. And you're just not going to get enough of that at your appointment in the clinic. We have to have you working at home on this as well. So some of the low-tech balance treatment, you'll see over there in the pictures, you know, these are classic. These are effective ways to work on balance. Please do not get me wrong. I want to make sure you're aware of that. Effective ways. So, you know, maybe it's standing on an unstable surface and reaching for something. We're doing an obstacle course. We're doing the standing on the foam with the eyes closed. We're changing the base of support. We're walking while moving our head. Those are all activities we can do. Or we can do some high-tech balance treatment with our virtual reality activities with our Virtualis. This lists out some of the programming that we can do. So these are quick pictures. They probably don't have a lot of meaning to you as they are right now, but hopefully after you watch a little bit of the video, you'll be able to see what they are. In this next video, this gives you a nice overview of what some of this looks like. All right, here we go. This one's probably, I think it's just got some fun music with it. Taking it into the goggles, what are we seeing? So that's just kind of an overview. And then I picked a couple that we did a presentation a while back, so we have some good footage of what some of these more specific programs might look like. Let me pull that up for you. All right. Okay, go ahead and just start by looking straight ahead. I'm going to mute that. Okay. So in the upper right-hand corner, that is our subject. That was our student that was working on this. And then the screen in front of you is showing you what he sees. Now, the things like the settings, this is actually what I see on my screen. So as the patient, you would not see, the thing that says timer, left hand, right hand in the settings. What this is showing is that those two controllers in his hands, when you get into the virtual environment, they actually look like paintbrushes. He's got the blue one. He's going to load that up with some paint. And then he's going to shift his weight and rotate and try to paint the pottery, okay? A lot of our modules that we use are, I say stripped down. A lot of the video gaming virtual reality systems are really overwhelming. They are high stimulation. The rehabilitation virtual reality allows us to kind of scale that back a bit so it's not so overwhelming. We can focus on specific tasks. We start getting control of the different elements to make sure that we are getting the patient to do what we want them to do in the physical environment. Then we can ramp this up. So right now, we were doing this when you don't necessarily have to be on the platform. So this one I've done with people and we'll do it. Yeah, they're in there, but we might be standing on the foam and doing, or standing on different surfaces or things like that. That's that one. Let me pause for just a second. This one is a patient favorite. This is Whack-A-Mush. So if you've ever played Whack-A-Mole, okay, if you've ever gone out to one of the game places and done that, and the little moles pop up and you smack them with the mallet, we can do this one, okay? So he's got the controllers, he's in the headset, the mushrooms are popping up. Again, we have a lot of degrees of control of this one. We can have more mushrooms, we can have more traps, we can make it so that you're only supposed to hit the red ones with the red mallet, the blue ones with the blue mallet. There's a lot of different ways we can set this up, and again, also changing the base of support. This one is the one where you, as the clinician, we really have to stay out of the way. And, be safe, but also give people space, or we get hit a little bit here and there, but it's all in good fun. And then the last one I wanted to show on here today is the balloon wall. You saw it a little bit in the other video too. Here we go. I want to go to about there. Okay. Oh wait, I'm sorry. Jeez. Sorry. Technical person did not do what they were supposed to do here. I'm sorry. 5, there we go. All right. So we've got our good balloon wall there. Now his controllers are needles, and he's trying to go through and he's looking around, reaching, popping different balloons. These modules we could all, if we have somebody that's, really needing to do this in a seated position, maybe we're working on something more like a sitting balance rather than a standing balance, we can do these seated as well. And again, controlling some of those different pieces of it where we're, how many balloons? Are we only popping red balloons with the red needle, blue balloons with the blue needle, and then we put traps in there. It's like, oh, but if you see the yellow balloon, don't pop that at all, leave it alone. So we're adding a little bit of a cognitive task to it. There we go. So there we go, finished about a few seconds late. So thank you for your time and watching. If you have questions, I think we'll be here for a few minutes. This is our contact information, and if you feel like you need a referral for a physical therapy evaluation for balance, we do need you to have a referral for Medicare. Right?
And
ask
I
your
can actually
doctor.
go around with the microphone for anybody who has a question. Anybody have, you guys covered a lot of great information. You may have covered everything. Any questions? No. Well, that's quite impressive. I'm going to look real quickly to make sure nobody on the line had a question. It looks like we have no questions. So, gosh,